Welcome back to Healthy Living. Skin can be a very temperamental thing, subject to change whenever our environment, hormones, lifestyle, or the products we use do. Let's hear what our skincare expert had to say about melasma, also known as hormonal pigmentation, a considerable problem for South African women.
Doctor, what is hormonal pigmentation?
So hormonal pigmentation is a big part of our practice, and we have to know how to treat it, and then once again we have to treat it holistically. Because very often, if you look into the causes leading up to hormonal pigmentation, you'll find that very often the young women are on the oral contraceptive, and they thereby giving the body more estrogen, because hormone, it's dependent on the estrogen hormone. And then we look at the xenoestrogens due to unopposed estrogen. Okay, so what that means, when you eat foods that are not whole and healthy, when you eat a lot of tin foods, the lining of the tin, you get that plastic lining causes xenoestrogens down the line. So try eat whole, healthy foods, because when you are, eating too many processed foods, and especially tin foods, you are putting more xenoestrogens into your body. And then, like patients with constipation, the liver goes to all the problems of, all the trouble of actually getting rid of the estrogen, and then the estrogen lands up in the intestine, and because your transit time, the time that it takes for you to actually go to the toilet and pass some motion, your is increased, and then all the estrogens are reabsorbed back into the body. And you also have to make sure that you've got good gut health, because if you don't have the bacteria that help to get rid of the estrogens, you'll also get unopposed estrogen. So, and unopposed estrogens are the problems that come down the line when we start getting breast cancer and all these hormonal related cancers.
But how do then people identify hormonal pigmentation? What shows on this?
Okay, very often it's a very symmetrical pigmentation. And it's not that, like a sunspot where you have like a little dot every now and then. You actually get these patches of like grayish pigmentation, because especially if it's been there a long time, it leaches into the dermis. So because your skin exfoliates every 28 to 35 days, all the epidermal pigmentation gets rid of. But if those melanocytes that normally send the pigmentation up into the epidermis, they send it down, it gets leached into the dermis, and then that pigmentation sits there. And it's very hard to get rid of and very hard to treat. It normally takes months of treatments and months of topicals to actually stop those cells from producing melanin, and to stop those cells, those melanocytes, from dropping the melanin into the dermis. So very often it's symmetrical. You'll get it one side of the face, you'll get a patch here, you'll get a patch here, you'll get a patch here, you'll get a patch here. You'll find it on the top lip and on the jawline. So it's very symmetrical.
And then how is it treated?
It's like quite a difficult process, because number one, you have to wear sunblock to prevent the penetrating rays of the sun, which actually stimulate melanin. And then every night, forever, you have to put on a skin brightening serum that stops those enzymes that make melanin. And if it's really bad, then you're going to have to come in for treatments that increase the cell turnover and take the top layers of the epidermis off, so that your products can penetrate. So those are the peels that we do, and then very often we also do a transdermal treatment, pushing all these brightening products into the epidermis and the dermis to try and stop those enzyme, the tyrosinase enzyme that makes pigmentation.
So what's your advice to the people out there that suffer from this? What should they do? Where should they go to?
Yeah, it's very easy to say stop the pill. So you have to try, maybe speak to your gynecologist or speak to your clinic or your GP about perhaps going on to some other form of contraception. Then making sure that you stay out of the sun, but then obviously take your vitamin D3, because you need a vitamin D3. It's a hormone for all your cell processes. So you stay out of the sun, always put sunscreen on your face, and then every night, as I say, put your serums on that decrease those enzymes that make pigmentation. And remember, just one bad day in the sun can set you back. So it's very important to always keep your face protected. And then obviously make sure that your gut and liver are healthy, so that they get rid of all the extra estrogens that are produced in the body.
Knowing how hormonal pigmentation affects our skin, did you know that exercise has got positive benefits for skin health? Do join us in this week's workout routine. Burning fat is a goal of many people when it comes to exercise and eating healthy. But how do you do that with exercise? Do you do strength training or do you do cardio? My answer to that is merge the two together to do high interval training. And that's what it's about, where you combine strength and cardio, one after the other, in a variety of exercises to challenge your body to burn fat. And at the same time, tone those muscles. Ladies, are you ready? All right, let's go for it first. Warm up, and that's very important for us to do. I want us to shuffle the feet backwards and forwards for 60 seconds. All right, good. Your body should be warm. Now we're going to hit the workout with a few back-to-back exercises. Give it a go. Increase your duration if it's too easy for you, and then often repeat this entire workout as often as you can to really give you that efficient, effective workout for those muscle groups that you want. First one, ladies, the sumo squat. So angle your feet wide, toes out. And I want you now to sit as low as you can. Come up a little bit and go low. So you're doing short bounce-like movements. That's it, and this you do for 60 seconds. Good, up we come. Now immediately high knee running on the spot. Okay, let's go. High knees. That's it, keep it going. Good, relax it down. No rest. This is high intensity interval training, people. So from that position, what I want you now to do is feet shoulder width apart, and all that you're going to be doing is squatting down with a light jump. Let's go for it. Down, up. Good, relax it down. Hands come up and just punch in front of you. Go for it. Good, relax it down. And finally, just skip with both feet. Good, relax it down. How are you feeling? Feeling okay? Those legs begin to burn. Your heart rate increases. Your breathing rate increases. But remember, fitness is how quickly you recover. Do this sequence for 3 sessions or 3 routines, and you will have burned fat and toned your muscles. That's all we have for you on today's show. Thanks for watching Healthy Living on Afro Worldview. From me, Ronald Abaji, and the team, keep warm and healthy. Cheers.